Dr. Richard Bruno is the chairperson of the International Post Polio Task Force and a director of the Post Polio Institute. His book, The Polio Paradox, has become the Bible for many polio survivors. He promotes 10 simple rules to help people to cope with the effects of post polio syndrome.
The first commandment is listen to yourself. Polio survivors often turn themselves up from the neck down after they got polio. The first step in treating PPS is to listen to yourself, physically and emotionally, what you feel, when you feel it, and why. Our most powerful tool in treating PPS is the daily logs our patients keep that relate activities to their symptoms so that we can identify triggers that are causing symptoms and get rid of them. The second commandment is activity is not exercise. Polio survivors believe that if they spend an hour on the exercise bike and take extra trips up and down the stairs, that their muscle weakness will go away, when in fact the opposite is true. The more you overuse your muscles, the more strength you lose. Muscles affected by polio lost at least 60% of their motor neurons. Muscles that you thought were not affected could have lost as many as 40% of their motor neurons. More disturbing is that polio survivors with new muscle weakness can lose on average 7% of their remaining motor neurons every year. You need to substitute a conserve to preserve lifestyle for the use it or lose it philosophy that you learned when you had polio. The third commandment is break, don't break. The follow-up study of our patients showed that taking 2 15-minute rest breaks a day, that's doing absolutely nothing for 15 minutes, was the single most effective treatment for PPS symptoms. Our patients who took rest breaks, paced activities, and conserved energy had up to 22% less pain a month after we started treatment. But polio survivors who quit, refused therapy, had 22% more fatigue and 76% more muscle weakness a month after we saw them. For polio survivors, slow and steady wins the race. The fourth commandment is a crutch is not a crutch, and a brace is not a sign of failure or giving up. You use 3 times less energy and look better walking using a short leg brace on a weakened leg. Overused muscles and joints hurt and nerves die after decades of doing too much work with too few neurons. So why not use a brace, a cane, crutches, or dare I even say a wheelchair if they decrease your symptoms and make it possible for you to do more when you want to do it? The fifth commandment is just say no to drugs. 5 studies have failed to show that any drug or herbal remedy or magnets can treat PPS. Polio survivors shouldn't think that they can run themselves ragged or apply a magnet or pop a pill and their post-polio symptoms will disappear. Pain, weakness, and fatigue are not so subtle messages from your body telling you that damage is being done. Masking symptoms with magnets or morphine will not cure or even make post-polio symptoms decrease. The sixth commandment is sleep right all night. The majority of polio survivors have disturbed sleep due to pain, anxiety, sleep disorders such as sleep apnea, which is not breathing, or muscle twitching and jumping over your body during the night. However, polio survivors are usually not aware that they stop breathing or twitch. So you need a sleep study if you awaken at night with your heart pounding, with anxiety, shortness of breath, choking, twitching, or awaken in the morning with a headache or not feeling well rested. The seventh commandment is polio survivors like it hot. Polio survivors often have cold and purple polio feet because the nerves that control the muscle that controls the size of the blood vessels were killed by the polio virus. Actually, polio survivors' nerves and muscles function as if it's 20 degrees colder than the actual outside temperature. Cold is the second most commonly reported cause of muscle weakness and is the easiest to treat. Polio survivors just need to dress in layers so that they can control their body temperature. The eighth commandment is breakfast is the most important meal of the day. You know, for once Mom was right. Many polio survivors eat a type A diet. They have no breakfast, they have coffee for lunch, and maybe cold pizza for dinner. Our studies show that the more protein polio survivors have during the day, the less fatigue and the less muscle weakness they have. When our patients eat 16 grams of protein per meal and some protein snacks during the day, they have a remarkable reduction in fatigue and an increase in muscle strength. The ninth commandment is do unto yourself as you have been doing for others. Many polio survivors were abused by therapists or even family members when they had polio to motivate them to get better and to look normal. So polio survivors took control and became type A superachievers, the best and the brightest, doing everything for everybody except for themselves. Many polio survivors still do for others and don't even ask for help because they're afraid of being abused again. Accepting assistance is not the same thing as being dependent. Accepting assistance can keep you independent. One of our rules is if you don't feel guilty and anxious, you're not changing the way you've been your entire life and you're not treating your PPS. The 10th commandment is make doctors cooperate before they operate. Polio survivors are easily anesthetized because the part of the brain that keeps you awake was damaged by the polio virus. Many polio survivors stay anesthetized longer and have trouble breathing with anesthesia, whether it's gas anesthesia or intravenous anesthesia. Your polio history and any problems you have with breathing, sleeping, and swallowing must be brought to the attention of your surgeon or dentist, and especially an anesthesiologist, before you undergo any procedure. Polio survivors should also never have same-day surgery or even same-day outpatient tests like an endoscopy or a colonoscopy that require anesthetic. The final rule for polio survivors is the golden rule for friends and family. You know, treating PPS is more of a head game. The problems we have with polio survivors are more from the neck up than from the neck down. Getting polio survivors to get their heads around the conserve to preserve philosophy and getting away from use it or lose it. And well-meaning family members yelling at polio survivors, telling them to slow down and use a brace, actually does more harm than good. Friends and family need to know everything about PPS, need to help when asked, and let polio survivors do what they know that they need to do to take care of themselves.